Mm. Hello, everyone, and thank you for joining us tonight. My name is Kim Hodgson, and I am the Patient Engagement and Experience Consultant at Grand River Hospital. And tonight we're going to be learning a bit more about the role of patient, family, caregiver advisors throughout the hospital that have been working with us for a number of years now, and to talk about a new initiative, our Patient Family Advisor Network that we're launching, and to talk about some opportunities for members of the community to become involved with that work going forward. So we are very happy to have a number of staff and PFAs or patient family advisors joining us this evening. We have Jane Martin, VP of Clinical and Diagnostic Services, Andrea Guth, Director, Quality, Risk, and Patient Experience. I've introduced myself. And in addition to that, a very warm welcome to the patient family advisors that have contributed to this presentation tonight and who will speak about their experiences working in this role and shed a little bit of light about what you might expect to contribute to and benefit from if you decide to become a PFA. So we'll be hearing from Chris Hennebry, who is part of the Integrated Planning Committee. She's contributing her expertise in a number of areas and has been a longtime member of the PACE Committee, which is part of our Mental Health and Addictions PFAC, or Patient Family Advisory Council. She'll talk a bit more about her roles later. We're also very, very happy to include Sue Langdon, who's the current chair of the Cancer PFAC. She contributes to the Oncology Leadership Team, Clinical Services Leadership Team, Patient Engagement Steering Committee, and many other things as well. And we want to acknowledge Joanne McPhail, who unfortunately can't be with us tonight, but Joanne has been an absolute rock star of a PFA here at Grand River, is a member of the Cancer PFAC, and takes a role and a leadership role on so many committees, both at the board level, the different clinical program level, and advises on a number of initiatives across the hospital. So I'd like to welcome Jane and give you the opportunity to say a few words.
Thank you, Kim. As Kim said, my name is Jane Martin, and I am the Vice President of Clinical and Diagnostic Services at Grand River Hospital and the Regional Vice President for the Waterloo-Wellington Regional Cancer Program. It is my privilege and great pleasure to welcome you today to the Patient and Family Advisor, or PFA for short, webinar. Across Ontario, healthcare professionals, policymakers, and organizations such as Grand River Hospital are actively engaging with patients, their families, other informal caregivers, and members of the public to understand their needs, experiences, and preferences to improve healthcare, and partnering individual healthcare professionals, healthcare organizations, patients, and their loved ones in different ways to understand their experiences, their preferences and needs, and respond to them only improves the quality of care that we can provide. Patient engagement is a key focus of the 2021 to 2025 Grand River Hospital Strategic Plan, and the hospital is committed to make sure that patient, family, and the caregiver perspective is included in all that we do. Grand River Hospital also values diversity, equity, and belonging, and we have a value of welcoming one to welcome all. We are really looking at diverse and interested individuals to be patient and family advisors so that we can obtain input that is representative of the community that we serve. The role of the patient and family advisor started in the oncology program about 10 years ago at the hospital. And over time, the role of the patient and family advisor has grown tremendously in activities and supporting both clinical and corporate programs. Patient and family advisors are invaluable at Grand River Hospital. I have personally had the ability to work alongside PFAs, and I cannot stress how much I and the organization have benefited from the lived experience, ideas, and feedback as we work towards our vision of world-class care. Patients are at the center of the care that we deliver. I hope that this webinar will provide you information about the role of the patient and family advisors and the many ways that you can become involved in this volunteer capacity at Grand River Hospital. I hope that the information shared tonight piques your interest and inspires you to express interest in joining this expanding group. Working together, the Grand River Hospital vision of a world-class health system supporting healthier lives can be achieved. And I would now like to introduce Andrea Guth, Director of Quality, Risk, and Patient Experience. Andrea will further explain about patient and family engagement. Thank you.
Thank you, Jane. So what is patient engagement? It's more than just having patients present in our meetings, on our committees, or asking patients to provide input into our education materials and items that we provide to patients. It's really about partnering and collaborating with patients to understand what their needs, what your needs are, and how you would like to assist us in shaping the way your healthcare is planned and delivered at Grand River Hospital. Why is patient engagement important? For many, many reasons, more than we can fit on one slide. But we really believe that patient engagement improves the overall care that we provide at Grand River Hospital, helping us to ensure that we are meeting the diverse needs of our patients and families, that we're improving the experience that patients have within the hospital and the satisfaction that they receive with their care, as well as improving the safety and overall quality of the care that we provide at the organization. Ultimately, patient engagement is about ensuring that we do nothing for you without including you in the planning and creation of what we are delivering in terms of care at Grand River Hospital.
Thank you, Andrea. As Jane so eloquently covered, patient engagement is a very important strategic direction here at Grand River Hospital. And as Jane said, we intend to deliver a world-class experience for patients, families, and team members. So we want to integrate the patient and family voice into everything we do. So currently, we have 3 PFACs, Patient Family Advisory Councils, serving in our hospital, one in the cancer program, the renal program, mental health and addiction. And then we also have a PFAC that is a part of the regional stroke program, and that draws from a wider area than simply Waterloo, Wellington. So we have PFAC members there who serve in different capacities as well. So in addition to serving on those programs, specific PFACs, many of the individuals also provide their experience as a patient or caregiver to a vast array of activities across the hospital. And we're really finding, as Jane said, that the more we involve patients and families in the planning and delivery of our care and how that looks like and how do we improve based on their feedback, the more we realize that we really want to have more voices, have a diversity of representatives from our community participates, which is why we're kicking off the PFA Network and looking to recruit and support the work of others in our community so that we can continue and to fulfill all the different engagements that we do have across the organization. So what does a patient family advisor do? Well, you're going to hear right from the PFAs shortly, so I won't exhaust this, but essentially you bring experience about what it's like to be a member or a care partner at Grand River Hospital. By sharing your stories and your experiences with hospital staff, physicians, other patient family advisors, your insights help us to understand better what your journey has been like, what the pain points have been, and what your ideas are for improving our programs and service for everyone. So your experience helps to shape a better experience for others who may be in the same boat. And also we are able to take your suggestions and see how they might relate to other program and services areas where it's applicable. So in addition to programs and services, we have PFAs working in a variety of roles. Sometimes it's to critique a policy and, for example, our hospital visitation policy, and to understand what any potential changes, how they would affect a patient or their care partner and family, and what that will mean for them. So even though as staff, our very best intention is to make things better, we have to make sure that we don't have any unintended consequences of our of our planning that we didn't think of. So that is why that patient and family voice is so crucial to the work that we do, so we can make sure that we are seeing all sides of things. Now I'm going to share this with Sue. Or I'm sorry, I think that might be Chris, pardon me. Chris, did you want to highlight some of these?
There are many, many roles that are available. As a patient family advisor, I sit on 5 committees. For instance, I sit on the integrated planning team, otherwise known as IPT, where all of the hospital business is being planned for the next 1 to 5 years. I feel very privileged for this opportunity to plan the hospital futures, finances, policies, and activities. At the FACE Committee, which stands for Families, Awareness, Change, and Education, which is in the mental health and addiction department, only about an hour and a half a month are involved, unless we are looking at a specific special project. In the Ontario Health Hospital West Regional Advisory Group on patient portals, we are working on apps to be able to access medical attention and or our records with ease within the province. So these are some of the things that we're working on that I'm involved with.
Thanks, Chris. What a range of activities that you're involved with. That's very helpful to hear about that. And I know that one of the characteristics that Chris brings to the group that I work on, the Patient Engagement Steering Committee as one example, is that she very much is able to bring that experience as someone who has access services at Grand River. There's lots of characteristics of a good PFA. So being able to use a personal experience of either yourself or a loved one, to use it constructively, to kind of take the learnings or the pearls of something and to kind of generalize them and say, how can we make it better for everybody? That ability to see beyond your own experience is really crucial. As well, and Chris, this comes out in heaps when I chat with her, the desire to contribute to meaningful change. Any of the PFAs that you'll speak to, it may have started with something quite personal, but they are there to make things better for everyone. Being a good listener, being respectful of other perspectives is really key. I think that as PFAs work with each other and with staff in a variety of program areas and clinics, there will be a diversity of perspectives at the table. And we may think that one way might be better or another, but one of the key traits of a PFA is to listen carefully, try to understand, ask questions for sure, but try to see the perspective of others and bring yours to it as well. So being able to work collaboratively in working groups and committees, comfortable speaking in a group, and for many of us that isn't something that's natural. We learn as we go, and that's totally fine. And another really key characteristic is to be able to maintain confidentiality of any patient and organizational information. So these are a lot, but they're all important, and different ones come into the focus in different experiences. So at this point, we're going to hear from Sue Langdon. Sue, can I hand it over to you?
Yeah, sure. I have some great thoughts from my good friend Joanne McPhail, who was not able to join us this evening. She is a fellow patient and family advisor. So these are words that come from Jo that I want to share with everybody. As PFAs, we lend our voice at the table, whether it be patient and family advisory councils like the PFACs or FACE, focus groups, advisory or steering committee of the board, reviewing educational materials, etc. We draw from our own personal experience as either a patient and or a care partner. Some of us have been both a patient and a caregiver of a loved one. By lending our voice and sharing our experience, staff have said that it helps keep them grounded in their work, helps keep patients and their caregivers at the center of what they do. In some instances, after hearing our voice, it has changed the pathway or focus of the initiative. Hearing our point of view can help staff think of something or add something to their work that they hadn't thought of before. We can also assist in developing communication for other patients and care partners to be better understood or include more information that makes the information clearer. A few of us helped with communiques that went out to patients during COVID. Staff appreciate us reviewing these documents and assisting to give a better understanding for the patient. I feel that we partner with staff. They have the training, education, and knowledge, and we have the experience. We have the arm at the end of that needle, the one taking the drugs and experiencing the surgery. So by partnering together, the care can only get better and better. For me, this is my hope and my passion. So I'll keep going if that's all right. Kim, more words.
Go right ahead. Thanks.
Okay, more words from my friend Joanne. You don't need any special qualifications to be an advisor. You just draw on your experience as a patient and a care partner at Grand River Hospital or the Regional Cancer Center. To have a willingness to lend your voice at various tables, to be comfortable in sharing your story, your experience, or the experience of the person you cared for. A willingness to volunteer your time, and a willingness to participate in committees or one-time events. A willingness to read the materials and come prepared for the meetings, to be someone that the group can count on to attend the meetings, and to be prepared to keep any information confidential.
Thanks so much, Sue. And then I'm going to hand it over to Chris to talk about how PFAs work in a variety of roles. She touched a little bit on that on a previous slide, but I'll turn it over to you.
Yeah, we do a lot of attend the meetings that and put our input in, and as Joanne said, we lend our voices and our experiences and participate in changes for to help out.
Perfect. Thank you. Yeah, it can be a real wide range of initiatives. You know, you may find that one month that you're providing some feedback on a policy, and then the next month you're invited to a work group, for example, that may meet over 6 or 12 months. So again, it's up to, we'll talk a little bit about how we match PFAs to assignments, but there are many roles, and one of the really nice things about working as a PFA is that you get to kind of choose where your skills and interests are, and where your time allows to do that. So again, the roles are quite diverse. It's a good fit for lots of people out there. Now we go back to Chris again.
I think this might be me.
Mm-hmm.
Yeah.
Oh, I'm Sue. Pardon me. Yeah.
This may be me. Yeah. Okay. So we offer our voice in we may offer our voice in a specific area of the hospital, like the emergency department, maternity and childbirth, the cancer center, mental health, or to Grand River Hospital as a whole. The duration of the engagement activities varies greatly. So examples of one-time events or situations where only one meeting is required. Maybe it's a survey development or review of information, like a mailing that's going out, or posters and information that's going to be shared in elevators or common areas throughout the hospital, or sitting as a member of a hiring panel for new clinicians, managers, directors, or executives. It could be a time-limited project, so you may meet more frequently for a certain number of weeks or months. Typically, the project has a start and end time frame, although sometimes the end is a bit of a moving target. I'm currently working on a few of these types of engagements, some in the cancer program, including some redesign of the clinics, and some committees with Grand River Hospital. We're currently meeting bi-weekly to develop some key strategies. I anticipate that these meetings will decrease in frequency and may stop altogether. Ongoing projects are typically a council or committee that you sit on monthly or quarterly. I sit on a few of these councils as well and feel valued as a patient voice at these tables. Sometimes engagements can be time sensitive and require a quick response, and sometimes the topic may be sensitive and even difficult. There is always a need to keep confidentiality and privacy concerns top of mind in all the engagements that you participate on.
Thank you, Sue. You really bring it to life, the range of activities. So thanks for sharing what you've been involved with. That's awesome. So Sue talked about this before around what is the time commitment that we're looking for. So initially, if you are a good fit for a PFA role, we're asking that advisors agree to a commitment of 1 year. And the reason for that is that it does take some time to orient new people to the role. And then we have kind of a corporate orientation where we talk about privacy and confidentiality and some other policies and procedures. So there's some learning right up front. And then after that, you'll be ready to consider different assignments and see where you'd like to contribute your expertise. So at least a minimum 1-year commitment and hopefully a long working relationship will give you time to see if you like the role, see what things that you're interested in. You might want to try on several kind of program areas or activities to see what fits you best. So we do ask for a 1-year commitment. So, and then to Sue's point, how much time you actually spend on an activity really varies depending on what the initiative is. It could be, in some cases, especially during with COVID, we've had policies and procedures, so to speak, that have required a really quick turnaround, and senior leadership team really wanted input, and we had about a day to get that, and people were very gracious to lend us their time and feedback during that. But typically we have you have more advance a heads up to say that something's coming and to think about it and to express your interest. So it really depends on the initiative, and it will be clearly spelled out as you consider it. You know, is it 6 months? Is it 1 month? Is it going to go over 2 years, for example? And the frequency of meetings and any in-between work that might be required. So it really does vary. And the point of this is that it may be people might feel a little bit overwhelmed to say, oh, gee, do I have the time to commit to this? But you do have flexibility as to what you take on. And, if you have parts of your year that are more busy than others, you may want to select things that work with your personal schedule. So just really briefly, I want to go through some of the steps to become a PFA. So we're launching this new network, and the new network of PFAs will work throughout the hospital, and they will be in addition to what I call the PFACs, the Patient Family Advisory Committees, in the 3 and 4th stroke program that we have currently going. So there's an online application that has gone live today, and it just asks for some basic information about yourself, what areas you might like to work in. If you have a particular perspective that you would bring that you feel the hospital should be hearing more of, that sort of thing. Also, there is a phone number, and if doing an online application is not something for you, I'm happy to speak with you and take that information down as well. So as we look through those applications, we will have a look and say who might be a really good fit for this, and people will be invited to have an informal conversation interview with myself and a couple other staff and some patient and family advisors. It's just like sitting around a kitchen table having a conversation. It's not formal. I don't think it's too stressful, is it, Sue? The ones I've been involved in have been very intriguing. So we get to know you, you get to know a bit more about the role, and we work together to see if that would be a good fit for you, what you'd like to do. So when we decide together that, yeah, this is going to be a good role, again, you'll be asked to complete the online orientation, to meet with myself and talk about where you would like to focus your efforts and what you think you can bring to that, or any challenges or questions that you have. And then we will work to match you with engagement opportunities that come up. So there may be on occasion times where we may need to ask for a reference or a police check. That's not typically routine at this point, but if there was something very sensitive by nature, that's a possibility. So we wanted to flag that. So once you're oriented, you're feeling good about the role, you'll be receiving invitations to participate on different engagements, and you can look at them and see if it's of interest, if it works with your schedule, and then you would express your interest, and then the staff member would, connect with those who have put their hand up, so to speak, to say, okay, who really is the best, or who would be a good fit for this work. So we support you throughout this whole process, and we also work with staff so that they can make sure that they're fully integrating your perspective as well. And I'm really excited that we'll be starting some quarterly networking and learning opportunities starting this spring. So that's a great opportunity to learn and to meet the other PFAs and have great conversations and learn and share. And I know that I've learned so much just going to different meetings and hearing from the PFAs as well. So that I'm really excited about that. So let's hear from those who have been. So if So Chris, I'm going to turn it back to you if you want to share a bit more about your experience, and then we're going to hear about Joanne's experiences through Sue, and then finally, Sue, we're going to hear from you. So I'll turn it to Chris.
Absolutely. Thank you. So one of the benefits of participating is that we have the opportunity to shape the future care and care level of our healthcare. As a PFA, a patient family advisor, we are included in shaping, amending programs and services. We assist in updating existing protocol as well as policies, procedures, examples, discharge plans, which are very, very important when you're in there. So we work with staff to improve the patient safety, which is very important to us as well. We participate in the programs of the FACT communities, the project, the hiring staff, the board committees. And the flexibility is that we can choose the committee that suits best our availability as well as where the most interest is.
Thanks, Chris. Sue, if you want to pick up something?
For sure. I have some thoughts from Joanne. So this is her benefits of being a PFA. I feel that when I walk into the hospital that I no longer feel alone because of the work I have been involved in. I know that there are so many working very hard behind the scenes to ensure that my outcome is the best it can possibly be. I find that very reassuring that I'm not in this alone. And then I'll share my thoughts as well. As a PFA, my care was exceptional at the cancer center, and I wanted other patients to have that same experience. It's really amazing to be part of a system that works hard to make each patient's experience better, to work with amazing individuals, clinicians, administrators, physicians, and frontline staff who work hard for the patient every day. I know it can be scary and stressful and intimidating to be a patient, and I want to make that better for everyone. Understanding the gaps or issues and working as a partner to make them better is a very rewarding experience. So many different opportunities keep emerging. There's lots of opportunities to be involved and influence all aspects of the hospital and patient experience. We need more PFAs. It's a really exciting time.
Thank you all. And if Joanne is listening, thank you for sharing your thoughts with us, Joanne, through Sue. Yeah, so that was a great segue, Sue. Thank you. So yes, this is exactly why we're looking to establish this this network of advisors to complement the existing PFAs in our in the PFACs that I was chatting about. As I said, we have such interesting, a lot of different opportunities that are bubbling up. I think the more that we embed patient engagement throughout the hospital, staff going, oh, you know what, I really could add that perspective to this planning, you know, and that's going to work. And it's not only something that we're getting more accustomed to, but there's more and more support. And we are so excited to be having this kind of seep through every corner of the organization. So we would welcome PFAs from all walks of life throughout our community. We really want to make sure that the voices at those tables are reflecting the diversity of our community here in Waterloo Region. So that is why I'm reaching out to different community groups and equity-seeking groups specifically to say, how would you like to be involved with this? Does this work? So I'm really excited about that work ahead. Quick overview of the timeline. So as I said, the application period is starting today and will go to April 22nd. And again, for those who may not be comfortable doing online applications, there is a phone number, and I'm happy to take that information from you over the phone if that is a better fit. We'll review the applications April 22nd to 27th. And once we kind of made sure that you know, the right people are being invited to that conversation, I don't want to call it an interview, it's very informal. That will happen towards the end of the month, April 27th to May 5th, and we will work with your schedule for those who are being requested to have a discussion. We'll work with you to find a time. It doesn't have to be during the day. We will be flexible to meet your needs. And then after we've had that conversation, you're going to think about, okay, is this something I'd like to do? And on the staff and the PFA side, we'll do the same thing. And we'll come to some agreement about who should be sent an invitation to join that group. And that will go out May 6th. So whether or not you're in that group or the ones who are thinking, well, maybe not right now, we will communicate clearly as to where we are in that process. And then starting in May, that orientation and onboarding starts. And so we'll walk you through how to do the online orientation. It's very simple to use, but for those like me who may not be tech savvy, we're going to help you with that. And then I will provide some personal support as well to get you going, to see what you're interested in, and to work with you to find those initial engagements where you can feel comfortable and supported in your role. So it's a little bit of duplication here, but what can you expect? You can expect to have a good orientation to this work, and onboarding personal support from myself and others. You'll get email invitations to participate that you can consider. And then there'll be all sorts of informal sharing and learning, and then we'll have those quarterly networking and learning sessions as well. So I'm going to just open up to our presenters. Would anybody else like to add anything that I may have missed before we open it up to questions? Yeah. Okay. Well, thanks to our speakers this evening. And Andrea, if I could ask you, I don't know if anyone has, actually, let me just back up a little bit here. If you have a question, just raise your hand, and you do that by, and I can't see it right now, I may have to, somebody walk through this. There's a reaction button there. You can raise your hand if you want to say something, or chat and type something in the chat if there are any questions.
Or if you're comfortable, I think we just have one participant that has had an opportunity to join us live tonight. And I really do, we all very much appreciate you taking the time out of your busy, what we know are busy schedules, to be with us this evening. So thank you. So if you do have a question, whatever you're most comfortable with, if you don't have any questions tonight, but you think of other questions afterwards, by all means, please connect with our website, and it will put you in touch with Kim or myself, and we'd be happy to address any questions that you may have as you explore this opportunity. So there's the hand. You figured it out. So yes, please go ahead.
Thank you everyone for this webinar. Sorry, I'm on my camera is off. It's due to internet.
That's okay.
That's fine. Welcome.
Thank you. So my name is Chezo, and I came across the advert for the thing. Yes, I said, okay, this is like a very interesting opportunity to volunteer in the community. So I said I would attend. So I'm very enlightened, especially the information shared by Joanne Yusu. I was very enlightened to hear and very encouraging. So something I would like to explore and see if it's a good for to serve the community. I just wanted to ask where I can find the form online. Yes, I'm not sure I saw it on LinkedIn. Okay. Thank you.
Terrific. Thank you. And thanks for joining us. So the link to the form, so if you go to the Grand River Hospital website, we have a new page, the patient engagement page. And on there, you'll see a little bit of information about our PFAs, programs that are in existence. And I think Julie has just put the link in the chat, so you can find it there. So as I said, it's online or a phone call, and we can take that information as well. And I really encourage you and others who you may know to apply. And we look forward to hearing from you.
I'll check it out. Thank you so much.
Thank you.
Jess, do you see the link in the chat there?
Yes, I do. I do see.
You do.
Fantastic. Thank you so much.
Okay. All right. Well, thanks to all of our speakers, presenters tonight. A warm, grateful thank you to our PFAs who inspire me every single day, and always lovely to work along with you to bring this your work forward. So thank you to Chris and Sue and Joanne if you're watching, and please do reach out if you have any questions about the PFAs. So thank you all. Have a good evening, and we look forward to hearing from you.
Thanks, Kim.
Everybody, have a good evening.
Thanks, everybody.
Okay, bye for now.
Bye for now.